Assalamualaikum dan salam sejahtera. Saya Megat Firdaus bin Megat Kamal, merupakan seorang penolong pegawai perubatan di Jabatan Kecemasan dan Trauma Hospital Putrajaya dan merupakan pelajar Open University Malaysia dalam bidang Bachelor of Medical and Health Sciences, Cluster of Applied Sciences, Januari 2021. Tujuan rakaman ini dilakukan adalah bagi melengkapkan clinical practice, mental health, NBCP 3912 dan pesakit yang telah saya pilih dengan simptom psikiatri iaitu Schizophrenia. Sedikit berkaitan dengan clinical practice mental health ini telah dijalankan di Jabatan Psikiatri Ward Hospital Putrajaya dan masa yang telah diperuntukkan adalah pada Februari sehingga Mac 2021. Sedikit pengenalan ataupun introduction for schizophrenia. Schizophrenia is a severe mental illness that affect 20 million people around the world. Ini berdasarkan Global Burden Disease 2017. Disease and Injury Incident and Prevalent Collaborator. I was writing in 2018. And then Copenhagen in 2017 stated that mental illness impact millions of people around the world live and well-being. Patel, Cherian and Atkinson in 2014 in their writing state that schizophrenia is a persistent mental health condition marked by a variety of signs such as paranoia, hallucination, disorganized speech or action, and cognitive impairment. For the patient detail, bagi menjaga tahap keresahan pesakit, saya namakan pesakit sebagai Mr. X, berumur 39 tahun, seorang lelaki berbangsa Melayu, warga negara Malaysia. Tarikh kemasukan adalah pada 15 Mac 2021. Pesakit merupakan pegawai kerajaan iaitu bertugas sebagai pegawai immigration. Underlying no any medical illness. For COVID status, no contact with COVID or PUI, patient under investigation, and patient also no recent history of travelling to red zone. History of present illness of the patient. Patient was brought by a police, admitted, and the documentation was signed by family members. Patient present with high irritability for 1 week, raised a voice and shouted, disorganized behavior, and hallucinator behavior. According to family members, patient had poor night sleep, not eating well, and laughing to himself. The beneficiary also informed that the patient was taking methamphetamine, also known as ice. For general condition, AVPU, patient was alert and conscious. For the airway was pattern, talk with full sentences, no vomiting and no retrograde amnesia. Patient unable to recall what happened before the brought to the hospital. For the breathing, patient was tracheal was central, good chest expansion, good air entry, no paradoxical movement. For the circulation, was good pulse volume, CRT less than 2 seconds, warm feverish, and then pulse puffable bilaterally. For the vital sign, blood pressure was 152/92, pulse rate was 72 beat per minute, SpO2 99% under room air, respiratory rate was good, 16 per minute, temperature 36.8, and then patient no complaint of pain, the pain score is 0, and the glucometer, tahap gula dalam darah adalah 6.3 mmol. For the patient history of psychiatric, patient has schizophrenia with effective symptom, was defaulted treatment since June 2018, then restart follow-up in July 2019 until September 2020. On patient on paliperidone, 150 mg monthly, but last given was on September 2020. Patient was started not sleeping at night, not eating well, laughing to himself since a week before admission. Before nephew called a police, patient started smiling to himself, spacing out, not engaging in conversation, singing loudly, and then patient also wore underwear on his head and raised his voice at his mother. Interview with a relative of the patient, as before, the patient noted had abnormal behavior for the past 1 week before the admission. The grandmother noted patient started not sleeping at night, not eating well, and laughing to himself. Nephew noted patient to be smiling to himself, spacing out and not engaging in the conversation. Okay, for the interview with the patient, upon starting the patient asked to hold on. Okay, upon starting patient asked to hold on, stare blank for a while and then asked to proceed. Patient claimed that he is well and no other issue. During the interview, patient suddenly shouted into thin air, cursing and pointing at the sky. Patient as he wanted to hit the bed but did not proceed. Due to this condition, patient was given I am hello ED to release the the pressure or for the patient. For the mental status examination MSE, patient is medium build Malay gentleman, speak in Bahasa Malaysia and speak irrelevantly, was wearing casual clothes and fair personal hygiene. Patient coherent at time, shouting on and off associated with hallucinator behavior. Okay, for general appearance, physical patient are dressed, washed, and clean. Hair is black and short, wearing a casual clothes, wear a glasses and had a slightly bare beard. Sorry. For the level of awareness, patient was conscious, weak eye contact, and lack communication during question and reply. For general behavior, patient was restless and will not cooperate, not focus completely during the interview session. Okay, continue for the MSE. For the emotional, the patient mood was euthemic. Effect was restricted. For the speech, the patient discussion substance is factual, clear, and meaningful. The intensity of conversation is moderate. Disorder of thought, no sign of delusion. Disorder of perception. Patient had a third party in which patient hear multiple voice hallucination. The patient, okay, many night noises that then a day sound are heard by a patient. Okay, untuk kondisi ini condition ini, pesakit tidak pasti apa yang disuruh oleh suara orang ketiga itu. Suara itu tidak dapat dijelaskan dengan baik oleh patient, ataupun dengan kata lain patient pesakit ni tidak faham apa yang diperkatakan oleh orang ketiga ataupun suara ketiga ni didengar oleh patient. Okay, untuk for the cognitive process, orientation was good, can define time, place and people around such a doctor and paramedic. Memories was mine, could could recite things showing to him, but unsure his birthday and home address. For the attention was poor, not fully concentrated on the question. Focus was good. Abstract thought for also was good. Can make a cat sound when asked. Judgment also good. Patient can answer what to do if had emergency such as accident, to call 999. Ask for the ambulance, ask for police anything. For the general knowledge, patient was good. Can answer who is current prime minister, and for the insight, patient also was good. Etiology for schizophrenia. Factor predisposing for operation for is stress and improved enforcement, and factor for perpetuating for the patient is a single and addicted. Treatment and management, patient for antipsychotic medication, by stabilizing dopamine level in the body, patient psychotic symptom are reduced and controlled. Patient was given as prescribed on the night tab or olanzapine 5 milligram and tab aripiprazole 5 milligram. Okay, for the psychology management, adaptability for solving problem. I help patient deal with a problem by interacting bilaterally and give patient guidance on dealing with multiplication of istighfar and prayer. Management of anger, teach the patient to deal with anger by practicing deep breath, take a deep breath exercise, changing the environment and getting closer to the Almighty Allah Subhanahu wa Taala. Okay, for the management of stress, I teach the patient to cope with stress more effectively by engaging in hobbies such as doing exercise, taking a deep breath, and finding someone with whom to share their responsibility. Social rehabilitation for activity daily living. Ensuring the patient always maintain personal hygiene and subsequently observe patient progress. For the therapy of interaction, helping patient to interact more with other peoples. In addition, encourage the patient to drawing and coloring to ensure the patient focus is not distract. For the recovery activity, I encourage the patient to exercise, especially in the morning. In addition, the patient focus can be set by encouraging the patient to create hobbies such as drawing. Okay. Sekian presentation bagi melengkapkan clinical practice mental health NBCP 3912 patient schizophrenia. Sebelum saya mengakhiri rakaman ini, saya berterima kasih kepada face to face tutor dan face to face tutor dan juga merupakan pengarah program BMHS, iaitu Sir Norhan Norris. Local preceptor Encik Muhammad Arifin bin Jasin, itu penolong pegang perubatan U32 yang bertugas di Jabatan Sekretari Hospital Persediaan. Tidak dilupa bahagian penyeliaan Hospital Persediaan dan penyeliaan Jabatan Kecemasan Hospital Persediaan sendiri yang membenarkan clinical practice ini dilakukan, terutama sekali kepada Puan Aslina yang membenarkan penjadualan tugasan bagi membenarkan clinical practice mental health ini dilengkapkan. Sekian, terima kasih. Assalamualaikum.